The apical pulse has a stronger beat and is easier to measure than the other pulse sites. You may prefer to take an apical pulse when the radial pulse is hard to feel, when it has an irregular beat, or when it is abnormally fast or slow. An apical pulse is usually measured on infants and children up to 3 years of age. This is because other pulse sites are more difficult to palpate in younger age groups. The apical pulse is measured with a stethoscope placed over the apex of the heart. This is located in the 5th intercostal space, which is between the ribs at the junction of the left midclavicular line. Sanitize your hands before proceeding. Greet the patient and introduce yourself.
Hi, my name is Kim. I'm going to be your medical assistant today.
Identify the patient and explain the procedure.
Joe, I need to listen to your heart rate today. Is that okay?
Yes.
Have you ever had that done before?
Yes.
Okay, can you please take off your shirt?
Yes.
Observe the patient for any signs that might increase or decrease the pulse rate. Assemble your equipment. You will need a stethoscope for listening to the patient's heartbeat and an antiseptic wipe. If the stethoscope has both the diaphragm and bell, rotate the chest piece to the bell position. The bell lets you hear the sounds better. Clean the earpieces and chest piece with an antiseptic wipe. This removes microorganisms and prevents their transmission. Apical pulse can also be measured with the patient lying down in a supine position. Both of these positions give you good access to the apical site. The chest piece of the stethoscope feels cold when placed on the skin of a bare chest, which could startle the patient and increase the pulse rate. To reduce patient discomfort and ensure an accurate measurement, warm the chest piece with your hands first. Insert the earpieces in your ears with the earpieces directed slightly forward. This makes it easier for you to hear the patient's heartbeat. Place the chest piece over the apex of the patient's heart at the junction of the 5th intercostal space and the midclavicular line. For most patients, this site falls several inches below the nipple. Listen for the heartbeat. You will hear lubbed-up sounds. These are the sounds caused by the closing of the heart's valves. Each lubbed-up represents one heartbeat. If the heartbeat is normal, count the beats for 30 seconds. Multiply this number by 2 to arrive at the reading for 1 full minute. Joe's heart rate for 30 seconds is 40. Multiplying this by 2 means his heart rate is 80 beats per minute. If the pulse rate is abnormal in rate, rhythm, or volume, continue to take the pulse for 1 full minute. The normal resting pulse rate for an adult ranges from 60 to 100 beats per minute. In a healthy individual, the rhythm should be regular and the volume should be strong. This pulse has a normal rate and rhythm. This pulse is exhibiting bradycardia. This pulse is exhibiting tachycardia. This pulse has an irregular rhythm. Sanitize your hands and chart your results. Include the date, the time, and the apical pulse rate, rhythm, and volume. Clean the earpieces and the chest piece of the stethoscope with antiseptic wipes.